Good evening, everyone, and welcome to our webinar tonight on the dentistry interviews. I hope that everyone is really excited for this because we've got a great lineup of speakers tonight. I know that this is probably one of our most subscribed webinars, so we're just letting the last few people trickle in and then we'll make a prompt start. So tonight, what we're going to be talking about is the dental school interview, and on our panel tonight, we've got the fortune of having a very diverse range of individuals, from first year dentistry students to those who have graduated. And we've also got a special guest as well. So on our panel, we've got Raza Ahmed, who is a first year student at Leeds. He's also the co-founder of I Want to Be a Dentist. We've got Jasmine Batro's for final year, actually, at the moment in Plymouth. That's been changed. Fadila is a third year dentistry student. Jenna and Adam are both final years. Myself, I'm a qualified dentist. And then we've got a special guest who is also a YouTuber and third year dental student, Faris. So what I'm going to be doing is just admitting everyone into the waiting room. If everyone could turn themselves on mute, and if you have any questions, we've got our chat facility. So if there's any questions that you have throughout the presentation, please pop them in the chat facility. We'll also be having a few short breaks and questions and answers throughout, and a dedicated question and answer session towards the end of the presentation as well. So I'm going to just move on to the next slide now and begin the presentation. So the learning objectives of today's presentation is just to briefly talk about who we are, and we have got some information on the new dental school interview, which is now taking place online. There is information on the dentistry panel interview by Jasleen. Then we have information on the MMI interview by Faris and Fadila. And then we're talking about managing stress during interviews, and Jenna and Adam will be talking about that. And then we're going to go through some tips from everyone at the end, and have a question and answer session as well. About us, we are a platform, and we've been set up since the first lockdown, actually, to help individuals through all stages of their application. And we aim to support applicants through every stage. We're really excited to be able to share our cumulative wisdom to individuals like yourself who are attending tonight for free. And we really do hope that the information that we share has a valuable impact on your learning, and also helps with moving you forward in the right direction towards your aims and your objectives. We obviously have various services as well, and we're really excited to launch the new online dental school interview course, which is actually launched right now, and you guys are the first people to have access to that. So if you've got a phone, you can scan the QR code on the screen and you'll be able to have instant access to that. We're also very keen advocates of helping individuals from all backgrounds, and therefore we have a bursary scheme available as well, which means that you get 50% off. In addition to that, we have lots in store on our course. The course itself is really full of lots of information, really the latest information regarding the interview. We cover content for undergraduates and postgraduates. We have 15 modules covering lots and lots of content, including an MMI and panel mock interview. We have lots of interview questions, and we aim to help individuals throughout the entire duration of their membership with us. In addition to that, we have a dedicated team of individuals for one-to-one mock interviews as well, which is really exciting because we have a very diverse team of mentors, and you have full access to those under the various packages as well. So it's really exciting milestone that we've achieved, and we're really proud to share it with you as well. And there's a lot that you guys can benefit from on our website. Our packages vary from the basic packages to the most comprehensive package, with the basic packages covering the online interview course and as well as the mock interview to the most comprehensive packages, which include the mock interview and the 2-hour tuition. So we're going to go straight into it now. We're going to talk about the new online dentistry interview format. And I'm going to open the mic up to Raza, who's a first-year student at the University of Leeds. So Raza, are you there?
Hi. So thanks for the introduction. So I'm going to be talking a little bit about the new type of interviews that they're going to have online. So there's, if you can, I just can't see the slides. There we are. So as we all know, due to the pandemic, there may not be any interviews conducted in person this year. Some universities have already updated their website and they've told everybody that they're going to be using platforms such as Zoom or Microsoft Teams to conduct online interviews. Now, online interviews, they're going to test your face-to-face communication as well as assessing some key skills throughout the whole interview. Now, there's some different types of assessments that they'll be conducting, but due to the pandemic, we're kind of still unsure of how it will go ahead because this is the first time we've been put in this type of situation, so we're still not sure exactly how the interviews will be conducted, or they may be still in MMI style, but they might also do panel style. But it kind of depends on the university itself and how they present forward their interview styles. So I think next slide, Cal.
Go on.
So, like I said before, they might use formats such as Zoom or even Microsoft Teams, and you'll be given instructions in your introduction email from the university when you actually receive the email, receive the application for the interview, the invitation. And yeah, they may change, because most of the universities did do MMI before, they may change it to panel this year, because it's kind of difficult to conduct an MMI interview online, because in your traditional MMIs you have stations and you go around, but of course it's all virtual now, so it might be a little bit different to what you expected, but there are still ways you can still prepare for the changes that have been presented this year. So next slide. Right, so there's a few things that you can actually do to prepare well ahead. Keep up to date with your university, check their websites, check your email, and prepare in advance. Now, the ways you can do this is by getting used to the format of the Zoom and Microsoft platforms. It's the first time we've been placed in this situation, so you kind of have to bear with the university as they adapt their interview style for different days and stuff like that. So it does reflect the importance of staying up to date with the changes being made. So it might still be that some universities decide on the last minute that the lockdown's been lifted and they may still get you in. But whatever's stated in your university emails, that is what's most likely to go ahead. And you should always stay one step ahead by just keeping up with general news and staying up to date with the university's website. Next slide. Another thing that you can do is ensure that your tech is up to date. So make sure your Wi-Fi is in working order and your IT equipment, such as a laptop or an iPad, whatever you're going to use on the day, is ready to get going with. Also, this is something that you should plan way ahead of your interview. So when you get the actual invitation, you should already be thinking about how you're going to set it up and the steps that you will take to prepare yourself for the day. Of course, if you're doing your interview at home instead of a library or anywhere else, or private place, then make sure your family members or whoever you live with, they're aware, because you don't want any noise or anything like that. Next slide. Okay, so there's a few things that you can do in the actual virtual interview. Your body language and posture is very important. Of course, you can use hand gestures, place the camera at a good height, and sit how you would in a normal interview. Try and keep it as relaxed as possible and try and keep a normal conversation going. Make sure to practice this in front of your family or friends, or even online with our services. We have a one-to-one online mentoring services, which is now available. So you need to understand that non-verbal communication is just as important as verbal communication. things that you do, such as eye contact, make sure to look directly at the camera and not just at the screen. It just shows that you have the self-awareness to do that. Also, dress smartly and appropriately. You don't want to turn up in a t-shirt or anything like that. It's professional, so make yourself look the part as well. Also, avoid any unnecessary jewelry for females, or have a clear desk, as well as a nice, neat area to study, or things that you need to prepare. Avoid having any sticky notes around the laptop or anything like that. It's quite obvious when you end up doing that, especially because the interviews may be recorded and they may want to refer back to it. And it's quite easy to see if you've been reading off anything, which can actually hinder your chances of getting the interview, getting an offer. Also, orientate yourself towards the camera, like I said before, and maintain good eye contact. And next slide. That's it from me.
Hi guys. So I'm just going to go over a bit about the panel interviews. So firstly, panel interviews usually consist of about 1 to 3 interviewers, sometimes even 4. And in a usual setting, you would either have a scenario before you go in, or just walk in after having like a briefing. And it takes about 20 or 40 minutes, and usually a conversational, question-focused style rather than a task-based style. But with Zoom, it's probably, you'll either get an email before you sit the panel saying like, this is the scenario we're going to talk to you about, or this is how we're going to run the day. So just follow, like Raza said, follow that email that you get. And also, as Raza said, make sure you're dressed appropriately. That includes your bottoms. Don't wear pajamas underneath. Firstly, because it puts you in the mindset that you're in an interview. And secondly, if you were ever asked to stand up, you don't want to just have your pajamas on show. So it's just being careful like that and not kind of risking it. Also, in the past, panel interviews may give you ethical scenarios. So they give you something like, something happened, what would you do? And that starts the conversation. So when you walk in, they'll ask you firstly questions about that scenario, tell you to reflect on it and give your opinions on what you'd do in that situation, how you'd act. Then it will go on to questions like, why this university? What, like things like that. What do you enjoy about dentistry? What makes you a good candidate? Those sort of questions. So the main things they're looking for and asking is if you're prepared and if you're motivated for dental school, what your good qualities are that make you good for dental school and make you last the whole 5 years, your teamwork, interpersonal and communication skills, your problem solving abilities, and empathy, integrity and professionalism. This all being said, some of the panels do contain some lecturers that you'd have at uni, some dentists, some doctors, maybe even some students, but also may have a lay observer, so someone who's nothing to do with dentistry. It could just be a patient of the dental school, something like that, because they're very good at picking out what kind of person you are, how good you are at talking to people, how well you will be with patients. So you don't have to use big fancy words all the time. It's just how you present yourself. That's what they're looking for. It's not necessarily what you say, but it's how you say it and the confidence you say it with and your professional working speaking voice, things like that. Not just like, oh, I'm using big fancy words, I sound really intelligent. That's not really what they're looking for. Right, so next slide. So yeah, I've gone on a few tips, but here's a few more. So be prepared. Have a strong understanding of the dental school you're applying to. This is for any panel or MMI. Make sure you know, because a lot of places say why this school over the others. So it's good to know about the way they structure their course, what things are nice about the area, things like that. Also, don't over prep. It's really, really easy to tell when someone's got a mastered answer that they've revised so many times and they can reel off. It comes almost across like robotic and like monotonous. So it gets really boring for the examiner. And also you can kind of tell when they're generic answers. You can kind of like hear it in their voice and their attitudes. So just be as genuine as you can, show your personality. And everyone's answers are different. You have to remember that everyone's had different experiences of getting into dental school, different life experiences, different reasons that drive them. So if you just try and sound generic and say fancy stuff or things that you think they want to hear, they'll know that it's out of a textbook or that it's not what you experience. So just speak from the heart almost. Be engaged. So carefully listen to the questions and answer what they're asking. If you answer what they're asking, then you kind of hit the nail on the head, move on to the next one. If you dodge the question, they'll probe you more, or you can even create questions for yourself that you didn't want. So just make sure you're being really careful at what they're asking and try and structure your answer. So if they're asking maybe about work experience, don't then go off to talk about teamwork, because then they'll probe you more on that. Keep it to your work experience, what you enjoyed, what you reflected on, what you could improve on, what it made you see, things like that. Generally, more in-depth questions are asked based on your personal statement in panel interviews especially. So make sure you've read your personal statement before going into the interview, because you may forget what you've written. So just keep up to date with that. And say if you've done any research, so say you've like read a paper and you put that in your personal statement, keep up to date with the advancements of that paper, because they'll probably say, so what's going on with it now? And if you just go, oh, don't know, didn't really look at it again, then they'll know. So they are up to date with advancements. So you should try and keep up to date just with the stuff you've spoken about in your personal statement, not everything. They're not expecting you to know it like you're a dentist. So they also may be writing, especially on Zoom, they'll be making notes. So don't take that as a pass to not be engaged or do the same. Make sure you're still engaged with them. Make sure you're still looking at them and treating them as if they're having a conversation with you and looking back at you, because it's very easy to see them heads down and then you just kind of sit back and relax. You need to keep yourself like engaged in the process. Be interested. So convey a genuine interest and passion. Let your personality show, which I've explained before, and be yourself. So they'll ask a number of questions about your application, your experiences, general understanding of dentistry. And as I said, like Anne Ratzer said, having notes written around and stuff makes them think that it's not genuine and from the heart. It makes them think that you've tried to be the perfect candidate when actually you're hiding yourself, and that's what they really want to know. So yeah, that's about it from me.
Thank you, Jazz. Just going to go on to Fadila and Paris now with regards to the MMI interviews.
Okay, look, so time to move on to all things MMI. You just go on to the first slide, please. So, MMIs. The MMIs, interviews of this form have become increasingly popular over the past few years. They tend to be a really good way for universities to assess like a wide variety of skills and kind of see you guys in a more practical role. There's usually around 5 to 10 stations, each station lasting around 5 to 7 minutes long. And then sometimes they have rest stations, probably not more than 2. Each station then assesses different skills and qualities, and there'll be an interviewer present to assess you. What is worth noting is that each station's assessed individually, so the interviewer will have an inclination of what's happened and how you performed at the previous stations. So it's a really good idea to just know that in your head and kind of shake off like the last station and just take each one as a new one, because each one is basically like a fresh start. Next slide, please. Excuse me. So, common stations and how to tackle them. Starting with role plays. They're quite common. You should expect at least one role play. So while it might seem unnatural for a lot of people to, act out a scene, you are going to be expected to take part in these, not only at your interview, but throughout dental school as well. Try to forget about the whole acting part. Like, treat the situation as if it's real. You need to show that, you're caring and you're professional. And most role plays will require that empathetic, yet like ethical response. And the scenario usually will be clinical, but it can vary. I'd advise kind of beginning each role play with an open question, listen carefully, check that, the person opposite you is following throughout, and ensure that you covered everything on their mind, any concerns they have, and work with them to formulate a plan as needed. Next one's motivation for dentistry. So you're going to be expected to show a clear insight into the profession and kind of explain what attracts you to the career. So it'd be a good idea to avoid anything that might seem, like materialistic or shallow. I'd avoid saying, money is your main motivation. A key focus here is reflecting your dental shadowing plus any other work experience. In previous webinars, we've always kind of stressed on the importance of work experience and how versatile it can be, and how you can kind of get all those transferable skills that you collate at work experience. And it's really important to capitalize on that now. And like I said, reflect on it and explain how this contributes to your desire to pursue dentistry. It'd also be a good idea to have like a relative insight into other healthcare pathways that are similar, like medicine. So have an idea of them and then be able to justify why dentistry is the career that best suits, you know, your personality and your skill set. Next slide, please. So Faris, if you take over at this point.
Yeah, so just with regards to, you know, the common station types, like continuing on with what Fadila said, problem solving is one that comes up quite a lot. This can be presented in many different forms. You can either be given some graphs to interpret, you might be given some like mathematical questions that you must do. And the key thing here isn't to think, oh God, I haven't done A-level maths, I'm going to be absolutely useless. The interview is kind of looking at your process and how you deal with more difficult problems, how you make the correct decisions, etc. On top of this, you could be given like these lateral thinking questions and logical puzzles that can be a bit challenging. But again, as I said, you have to remember that a lot of candidates will find these difficult, and the way that the interviewer assesses you is through, you know, how the cogs are turning in your brain. So how you approach the question, how you break it down, and how you try and answer it and give the best answer possible. And with regards to ethics now, this is something that people really struggle with because they sometimes find it hard to integrate, you know, like a full, you know, like a meaty answer with regards to the GDC principles and medical ethics. But the main thing to remember here is that you have to provide a balanced standpoint. So you have to think of these as evaluation questions. So think of the pros and the cons, or think of the two sides of the situation or the scenario. When you do this, you show to the interviewer that you're professional, you have a neutral stance on things, and you're able to analyze things from, you know, like the correct point of view. On top of this, it's important to note the GDC principles. So don't try and shoehorn these in because it can sometimes sound a bit rehearsed and a bit, you know, robotic. But if you have the opportunity to integrate the principles of the GDC, of which there are 9, or, you know, the 4 core pillars of medical ethics, it can also help further your answer. But again, bear in mind, don't try and shoehorn these in. You should only really be mentioning them if it comes with the flow of the answer and if it's relevant in the way that you're answering the question. Next slide, please. Brilliant. Now, manual dexterity is another one. Some of you might be thinking, well, you know, interviews are online this year. How are they going to do manual dexterity questions? Well, I'd probably say that they might tell you to bring an object into your interviews beforehand and ask you to do certain tasks. So don't discount these from coming up because they can still be asked in your interviews. So don't just think because COVID's here, you know, these types of stations have stopped. And the main thing here, again, is understanding that, you know, sometimes it's going to be really difficult, but you just have to work through it systematically. So look at the instructions that you may have been given, or look at what exactly the task is at hand, and attempt to go through it in a systematic way. On top of this, even if you do think that you're really struggling, it's important to be composed and professional. So really take your time, really ensure that you're doing everything to the best of your ability. And with regards to your personal statement, this is quite heavily focused on panels as well. So in your panel interviews, you'll probably be asked a lot of questions on your personal statement. However, sometimes in your MMI, they might test you on this. So ensure that you know your personal statement in and out. One thing that I always recommend is to, in your own time, to look at your personal statement and go through the parts that you think are particularly strong or weak, and make, you know, kind of make some mock questions yourself to kind of quiz yourself on what could potentially be probed or asked. This is something that I found really useful in my interviews, and it really helped me out because I never had a question that, you know, threw me off guard. On top of this, I'd also say a lot of the time you'll mention examples of your skills in your personal statement, or you might give, like, you, for example, you said you've done DOV, etc. It's always good before the interviews to have extra examples for each skill that you've exhibited, just so that you can kind of stand out and not be caught out if the interview asks you, okay, you've said this on your personal statement, can you give me an alternative example? And yep, that's next slide, please. I'll let Fadila start this one.
Thank you. So general tips here, just how to prepare for your MMI interview. So first of all, research thoroughly into the university itself. Make sure you're aware of the location, the teaching style, societies they have, and any like unique selling points, unique facilities that they have. That's going to show your genuine interest in studying there, and then use these factors to your advantage by showing how they make you the ideal student. Secondly, know your personal statement like the back of your hand. So this is something that you've written previously to summarize all your, like, your personality and all your skills, and above all, your competency for a career in dentistry. Like Faris mentioned earlier, it's important that you've been honest as possible here. Practice role playing. So role play stations, like I said earlier, very common at most MMIs, and that's going to test your ethics, your communication, your teamwork, all of these skills all at once. So it's a good idea to practice this, whether that's with a family member, a friend, or even the mirror. Personally, I would say doing it with somebody is a good idea. So, you know, with someone watching you, someone responding, it's a good way to prepare. For example, you know, you can get a friend to act as a nervous patient while you play the role of like a junior dentist responsible for calming her down. Record yourself discussing hot topics in dentistry for 5 minutes. So hot topics like sugar tax or, you know, new like technological advances in dentistry. Not only is that going to give you, you know, that general base of knowledge, but it's also going to help you perfect your like time management and listen to yourself, you know, discussing these topics in a kind of succinct manner. Learn the GDC standards and core principles of medical ethics. So ethical scenarios, like I said, they're bound to come up in every MMI. It's important to recap these ethical guidelines set by the GDC. And that's going to then help you to formulate your answers and present a balanced argument without any bias, but also ethical scenarios tend to be quite complex. So you'll be able to kind of give both, like the whole scope of it. Like Faris did say, you know, don't just kind of shoehorn them in, don't force it, let it come naturally. But, you know, being well read about all of these things, it will then end up coming naturally because you kind of know what you're talking about. Learn about dentistry in general through articles and stuff, as well as the key skills provided by a dentist. Obviously, this is just key knowledge. You need to be able to relate yourself to the dentist and show why you should be there. So important, self-explanatory. But above all, you know, you can prepare everything, but it's like Jess said, it's not necessarily what you say, it's how you say it. You need to be confident. You need to convince the interviewer that you deserve to be there. They're not looking for perfection. You just need to do your best. Good luck. And that's us done.
Thank you so much, both. That was fantastic and really insightful. We're going to go on to managing stress during the interviews now. I think, you know, the interviews and dentistry preparation itself can be very, very stressful. So we've got Jenna and Adam who are going to be discussing these important aspects throughout this process.
Hi, I'm Jenna. Oh, is it Adam first?
No, it's not. I believe it's you.
Sorry. Oh, it is me. Sorry. So I'm Jenna. I'm an international student and I also got into dentistry through graduate entry. And I'm just going to talk a little bit about how to deal with stress during the interview and in the lead up, and also a little bit after as well when you're waiting for the outcome. So basically, I know a lot of people have already mentioned preparation, but I do think that this gives you the confidence under the pressure that you might experience. Applying to dental school is going to be a stressful situation for everyone. I think it's how you deal with it that kind of makes you stand out from other candidates. I think little things like knowing your personal statement, kind of setting up a situation that mimics the interview will just set you at ease knowing what you're going into. And so yeah, so I think it's important to realise that also the interviewers are aware of the nerves you might be experiencing, so don't let it get the better of you. Pauses are everything in an interview, I think, like taking a small rest before you speak, just to compose yourself. Yeah, and next slide please. So taking your care of yourself in the lead up to the interview I think is incredibly important, I think mentally and physically. I think doing activities that allow you to rest mentally and physically is really important. Basically anything that's going to make you cheer up or relax when you're taking a break between preparing for exams, your interviews, anything that you might have going on in school or university. I learned how to knit when I was doing my dissertation and also applying for dental school. I just thought it was nice just to have something on the side that I could just have a little break and focus on something else. Also eat well. You've got to be healthy to do your best, and just check in with yourself. If you're struggling with stress or it's starting to get the better of you, I think it's really important to talk it to someone. someone that maybe one of us that I want to be a dentist team, like we all know what you're going through, a family member, a friend, or even someone at school, university that you trust. I think that's incredibly important. And yeah, next slide, please. So on the day, obviously, it's nerves are to be expected. I think you just need to perhaps like plan your day out. If your interview's in the morning or the afternoon, maybe just have a slight idea of what you're going to do with the time before your interview. Maybe like plan what you have for breakfast, lay out your clothes, just have a little plan so it occupies some of the time and it doesn't get you worked up before your interview time slot. Also just don't be too harsh on yourself. Remind yourself that you have prepared for this. You do know what you're talking about. At the end of the day, it's about what you can bring to the dental school. So just have confidence in that. Obviously, we don't really know how interviews are going to be set out at the moment. Like, got a rough idea that it was probably going to be online. But obviously mind blanks are still probably going to be a given. You're not going to know the answer perfectly to absolutely every question that they give you. So I think it's important not to, especially with body language in this situation, now if you're not in person, not to become like subdued or like kind of shrink into the chair. Make sure you sit up, maybe look just slightly above your computer camera, take a deep breath, and then like compose what you're going to say. You're not going to be able to answer every question immediately, and the interviewers are going to understand that as well. Also, if you're traveling far to a different city, perhaps like further up north, further down south, depending on when you're living, consider bringing a family member to the city. They can probably keep you calm in the morning before your interview, and just while you're getting ready. By yourself, you can tend to get a little bit more worked up than usual, in my opinion, and in my case anyway. And like I said before, just to reiterate even more, like just take your time. Rushing questions isn't going to impress them more than taking your time to slowly and like eloquently answer. Also, if you're doing an MMI style, I'm sure even if it's on Zoom or Microsoft Teams, there will be small breaks in between stations. So just take the time to reset. As they've already mentioned, my colleague have already mentioned, you're gonna it's kind of a reset on each station. There'll be a new interviewer, so you can take the time to reset and have the faith and knowledge that well, this is another chance to impress someone else. But yeah, next slide please. Also, there's always going to be a little bit of a waiting time after your interview when you're trying to find out what the results of that are. Just keep busy. Obviously, we'll have lots of work with if you're preparing for university exams or school exams. But have the confidence that you've done all you can. Reward yourself. Try not to dwell on anything. If you've got another interview coming up, try and like think back and constructively think what you could do better. Try not to look on online forums. I think they can be a little bit daunting with everyone. It can be a little bit more of Chinese whispers with things that are going on. And yeah, just work on the things you can control and try and check your emails just so you can see like what's going on with the universities as well. But yeah, that's all me. Thank you.
Okay, hi everyone. I'm just going to share my screen because my presentation is on a separate thing. Cal, can you just give me permission to do that?
Yeah, if you should have co-host access now, Adam.
Well, thank you. So can you see my slide?
Yes.
Is that right? Okay, cool. Sorry, guys. Hi, everyone. My name is Adam. I'm a final year dental student in East London, and I'm just going to be elaborating a bit more on managing stress. So a little bit about me. I'm in my final year at Barts, or Queen Mary University of London, which is in East London. I applied to Barts, Newcastle, Liverpool, and Sheffield and got all offers. I've also sat on the Barts interview panel for 2 years as a student interviewer. And through that, I've kind of got a good idea of what's good and what's not. And the reason why I wanted to present this topic is because I'm researching it. I'm researching about how to manage stress factors in dentistry. And my main interests include pasta. So let's get straight into it. So it's important to understand first why being a qualified dentist can be stressful. You need to know this because number one, it's a really common interview question. And number two, you need to know why you need to be good at managing stress because of these situations. So firstly, patient demands and expectations. Now, I'm sure you've seen on social media, all these YouTubers going abroad to get all their front teeth chopped down and crowns put on and smile transformations and all that stuff. And your patients might come to you with those expectations, and it's only fair that they think like that. And it can sometimes be a bit of a challenge to explain that maybe this isn't the best way to go. We then have something called UDA targets. Now, for those who don't know, a UDA is a unit of dental activity. When you work in an NHS dental practice, each treatment you do is worth a certain amount of UDAs, and each practice has a target of UDAs to reach per year or per month or whatever. And because of the time constraints you have when seeing patients, it can sometimes be a challenge to complete these targets. Finally, we have patient litigation. So this is basically being sued. I remember in my first year, they got all of us to stand up, the lecturer, and they said, whoever is standing up right now, all of you will be sued at least one time in your career, which we all found quite shocking. The UK consistently ranks very high in litigation rates, and this isn't helped by the increased patient demands we've discussed before. And solicitors often have a no-win, no-fee policy, which just gives further incentive. So now let's look specifically at the interview. So obviously, it's a big occasion, it's pressurizing, and let's not lie to ourselves, you are going to feel a bit stressed at the interview, it's only natural. You also got to keep in mind with MMI stations, a really common trap when I talk to applicants is they've done one station, they messed it up, and then for the rest of the stations, that's in the back of their minds, and they mess up all the other ones. Please do not dwell on previous stations. It is paramount that you don't do that, and you treat each station like it's a new one. I remember when I applied to Liverpool, my first MMI station, I completely screwed up, but then the rest of them, I didn't let it get to my head, and I ended up getting the offer. So it's never over until it's over. Another thing to keep in mind, particularly with panel interviews, is sometimes they just want to test you out a little bit and see how you deal with uncomfortable situations. So they can intentionally act out on you just to see how you handle it. Now, I'm not saying this is going to happen every time, but it has happened to me before from personal experience. The interviewer got out his phone and started texting. And it was quite obvious when he did that. Don't let it throw you off. Don't let it stress you out. Please keep your cool and just do it as you would normally do it. And finally, waiting. I know this has been addressed before. You may be made to wait a while, not only after the interview, but maybe even before. You'll be briefed probably as a group, and then they'll split you up. It's hard to tell how long you're going to wait because everything is online now. But just be aware that the anticipation can be stressful. So I'm going to go a little bit into stress busting techniques. Now, a lot of these, you might not even believe that they work, but you have to trust me because they have saved me in interview situations. So the first thing I'm going to talk about is mindfulness. Now, hopefully a few of you have heard of this before. Mindfulness is basically a state of awareness where you are aware of your thoughts, but not overwhelmed by them. And it's actually something you can practice on a regular basis. If you go on YouTube, if you go on the NHS website, if you go on mindful.org, which is a website about mindfulness, you'll find these 5-minute exercises that really relax you and really relieve your stress. Please try one and try doing it every single day. And you'll find that this isn't even about the interview. With anything in your life, you'll achieve a lot more. Breathing exercises tie into that. So a really good breathing exercise, if you don't know where to start, is to sit straight, feet flat on the floor, breathe in through your nose and count to 5 slowly, breathe out with your mouth and count from 1 to 5 slowly. And especially when you're getting those pre-interview jitters, the interview's about to start, your mind is blanking, everything's all over the place, just do that, 1 to 5, in and out. It actually saved me in a lot of my interviews. The next two I'm going to talk about are called visualization and affirmations, and they kind of tie in together. So visualization is often used in athletics and in competitive sports. It's where you simply just close your eyes and envision your goal. And unbelievably, it works really, really well. So it can be something like you just see that offer coming in your emails, or you see the interview going amazingly for you. And affirmations work in the same way. It's something you say in your head, and even if you don't believe it, it can increase your motivation and lower your anxiety. So it can be something like, I'm going to smash this interview, the interviewer is going to love me, and they're going to give me an offer, no brainer. And you'd be surprised at how well it works. So I'm going to break it down. So before the interview, this has been mentioned before, preparation is the key to confidence. If you are confident, you won't feel as stressed. Simple as that. If you don't know where to start, that's what we're here for. Get in touch with one of us and we'll help you out. Practice the stress busting techniques I mentioned in the previous slide. Even if it doesn't really work for you, just practice it, because on the day, that could be the difference for you, believe me. Day before, this has been mentioned in, I think, the previous presentation, get everything ready for tomorrow, clothes, food, any documents, ID, all that kind of stuff, and chill out. Don't cram your information. Research has shown that the people that cram before something will do worse. So don't cram, just have a nice chill day, some light revision, and get everything ready. So on the day, it's no stress, you glide through your day, you smash your interview, and you get your offer. During the interview, just before you begin, breathing exercises, visualize, channel your stress into positivity. It's okay to be stressed. You're going to feel stressed. But if you are able to manage it, if you are able to just keep it calm, that can literally be the difference between an offer and a rejection. And believe me, I've interviewed hundreds of applicants with BARTs, and it's amazing to see how many people have done the correct prep, but they let the pressure of the occasion get to them. And it's so disappointing to see. And that's what I want you guys to avoid. As I've mentioned, don't dwell on previous questions or stations. Don't let it get to the back of your head. It's not over until it's over. If you have a mind freeze, you didn't hear the question, you don't understand the question, and you're panicking, just say something as simple as, that's a really good question. Is it okay that I have 30 seconds to think about how best to answer it? And they'll say okay, and they'll like you for it, because it shows that you're not a waffler and you actually care about your answer. So don't be afraid to do that. It's not a bad thing. And finally, smile. Everyone will tell you this. You'll probably forget it at the interview. Just try and remember it. Try and stay jovial. Try and stay enthusiastic. And they can also relieve your stress as well, even if you don't feel like it. After your interview, be proud of yourself, because this is not an easy process. That's why we've got a webinar for you. It's not easy. And it's really, really important that you reflect on your performance. So just think, what did you do well? What did you do badly? How could I change it so I can do the things I did badly better? That's it. It'll help you for your future interviews. And it's also a really good quality for dentists to have. Hint, hint, wink, wink, mention it in your interview. Continue your stress busting techniques. It will help for your exams. It will help for your future interviews. It will help your life. Believe me. And remember, if it's ever getting too much, just ask or just talk to someone. It can be family, friends, one of us, it doesn't matter, but reach out. So just to summarize, before the interview, prepare well, practice those techniques, mindfulness, breathing exercises, visualization, affirmations, all that sort of stuff. Just practice it. Try one tomorrow morning. It takes 5 minutes on YouTube. Just type in mindfulness exercise, click on the first one. At the interview, try a breathing exercise if you're getting the jitters, because I can guarantee you probably will. It can make all the difference. It can just have your mind in sort of a Zen state. And if you're not panicking and you're confident in your preparation, there's no reason why you won't get an offer. And finally, afterwards, reflect on your performance, keep stress busting, keep healthy, keep on exercising, have a healthy lifestyle. And if it's ever getting too much, just ask for help. And then you get your offer and you buy me pasta because I like it. And the final slide is a quote from Hans Selye, who is an endocrinologist and also pioneered stress research. And he said, "It is not stress that kills us, it is our reaction to it." You are going to feel stressed at your interview, and that's fine. But if you're able to manage it, compared to the person that's crammed the day before, panicking, thinks that fluoride is a character from Harry Potter, like all that kind of stuff, you're clearly going to do better. So learn to manage it and try those techniques. Thank you for listening. If you have any questions or anything like that, my Instagram is there, my email is there, and I'm also offering one-to-one mentoring with I Want to Be a Dentist for tailored advice for your interview. And be sure to visit the website, iwanttobeadentist.com. There's plenty of good stuff on there. I know I overran a bit, so sorry, but thank you for listening.
Thank you, Adam. That was amazing. Couldn't have said it better myself. I think handling stress is absolutely critical when you're studying for your dentistry interviews and when you actually become a student as well. So we've actually got quite a few questions in the chat. So what I'm going to be doing now is I'm just going to be going through those questions and I'm going to be answering them one by one. So this isn't a time now where everyone that's listening, I think we've got about 160 people, please do start typing away your questions so that we can start to answer them online. So I want to just scroll up to the top. So fortunately, we have recorded the webinar, so those people who may have missed out or come a little bit later, we will be sharing it on our YouTube channel, so please don't worry about that. Everyone will be able to watch it again. Right, so first question, what if I don't have any work experience due to COVID? What should I talk about at the station? So Shivani's asked that question. So Raza, do you want to just mention something that Shivani can say?
Yeah, so of course, like the interviewers know that there's maybe you didn't get work experience due to coronavirus, or your placements got cancelled. Of course, it's harder to get it in a dental practice as well because of the aerosol procedures. So it's more difficult to get students in. So there's much more of a risk there. I know that the University of Leeds said on a live webinar that they don't expect students to have work experience this year. So although you don't have work experience, it doesn't stop you from researching about the career. Work experience is essentially getting an insight into dentistry. Now, you can do that through many ways, reading articles, blogs. We have a work experience course as well, which is completely free of charge. You can go and have a look at that. The aim is to make sure you're ready to take on a career like dentistry, because it's a very unique career. It can get stressful and it's not easy to handle. So as long as you're understanding of the demands of a dental career and you're willing to put the work in and you can show that at your work experience station or what was meant to be your work experience station, then I think that will be adequate. It will be enough because you've done your research into what it's like to be a dentist or a dental student and you're aware of the pros and cons of dentistry. So that's something that you can mention out of work experience.
Excellent. Has anyone else from the team got anything to say in addition to that?
Yeah, just a quick one. Not only, like Raza said, are the work experience courses which you can talk about. Also, they just want to see that you're proactive. So even in a work experience sort of question, you can kind of turn it to be like, well, unfortunately I didn't get work experience, but I've tried my utmost to kind of learn as much as I can. So you could even say, like, if you can, you still have time to phone your local dentist and maybe even just have a quick conversation with them if they have time, to ask how things are run, what things are like. And also through the course, you'll be talking to actual dental students, and we can help give you an insight into what's going on. So don't be afraid to reach out to these people on Instagram through I Want to Be a Dentist, because that is all part of, like Raza said, part of your experience. As long as you're showing you're being proactive, that's all they can ask for.
Absolutely. I think that's valid points there. What is it like being a first year dental student? Sarah asks. those who are in first year? Raza?
It's
I think I'm the only one on the panel who's in first year. It's quite different. Some things I kind of expected, like the workload, but something that I didn't kind of expect was how independent you have to be. So you have to manage your time really well because you have lectures pretty much every day, 9 to 6, and there's a lot of content that you need to learn. And you need to learn it quick as well. But yeah, it's what I wanted to do. So it's a great experience overall so far, first semester. But yeah, it's kind of a unique situation to be in because you'd expect to go to the university, and while I have been in the university, many lectures have been cancelled and there's a lot of online stuff now. So that's something that I didn't expect at first, but it's just something that you have to adapt to. But overall, the university experience is going great, and yeah, it's what I expected.
Fantastic. So we've got a question here. What is the best way to practice dental ethics? Quite a broad question. Faris, do you want to have a go at giving your insight on that?
Yeah, so I'd say with ethical scenarios, anything to do with dental ethics, and anything, to be honest, with the interview, the best thing you can do is practice. Like, we can ramble on and say, read this, read that, but the best way for you to do things and the best way for you to improve is to practice, either with recording yourself or doing sessions on the website or like some mentoring. That's really going to be the way that you hammer things in and get feedback. And with regards to the ethical scenarios and how you can sort of approach these with the best way possible, it's important just to remember, number one, the interviewer isn't necessarily looking for the perfect answer. There's nothing that there's not something specific that you can say that they're like, yep, that's it, the answer's correct. It's more looking at your process. So seeing how you evaluate and you don't take one side. A lot of the time people fail because they think, okay, well, they're telling me, I need to treat one of these 2 patients. The whole point of this is that I have to tell one person, this is, I need to treat this person. However, a lot of the time they're just looking at your process. So make sure with ethical scenarios, basically just to sum it all up, you evaluate. So you look at both sides of the statement or look at both sides of the scenario. You try and integrate the ethical principles. So the 4 medical ethic principles. So that's non-maleficence, beneficence, justice, autonomy. I'd say, little top tip, the easiest one that you can kind of integrate is autonomy, because you always have to ask patients for informed consent or valid consent. So that one's a really easy one to put in if you're really struggling. Just a little top tip there. And the last thing I'd say is just make sure that you stay calm and you don't become too emotional. So you ensure that you maintain that professionalism, you show a level of empathy, but the key thing is just being evaluative and neutral in your answer. So it's quite a broad question. It takes quite a long time to actually explain how to answer these questions, but that's the best way I can sort of sum it up. So yeah, I hope that helps.
Fantastic. We've got another question related to dentistry work experience from Michael. I imagine most applicants this year will be in a position of not having completed much work experience. Could you relate it to your knowledge of dentistry from your own research? Fadila, do you want to have a go at that?
Yeah, so own knowledge is definitely very important. Like we said, research into the career as much as possible. You need to be able to show that your personality aligns with what the career is asking for. You need to show that you've got a realistic insight of what dentistry is. And whether that research is through reading articles or, speaking to dental students like ourselves, speaking to dentists, like we said, just bring up a practice and ask to speak to a dentist. All of it counts. The other thing when talking about work experience, it doesn't, and I've said this before, it doesn't necessarily have to be dental work experience. So what you can do is show your knowledge of your insight into dentistry through this research that you've done, because obviously work experience is a bit limited right now, and then show your transferable skills through anything else you've taken part in. So this is the proactivity that Jas was talking about earlier. So any volunteering you've done, anything extracurricular, so any clubs, any additional skills, any hobbies, things like that, they're all transferable skills. So bring them in when you're talking about work experience, and then use the research as well as any online courses to talk about dentistry work experience in particular. I hope that's kind of helpful.
Yeah, really useful there. We've got a question from someone who's from Scotland. They've been informed that there is a possibility of the current years will be held back to repeat the content, and there may be a delay until the 2022 intake. Is this something that is present in England? Does anyone on the panel know much about this?
No. that's not a thing, because I don't know what the situation is in Scotland, but at least for the UK, there's absolutely no way that that could happen, because that would put everything in the university, and with foundation training, which is what you do after your degree, it would put everything out of whack. So I would say I'd put a hard doubt on that.
Thank you, Adam. What kind of tasks would they make you do in the manual dexterity section? Something maybe Jenna can touch upon.
Hi. Can you hear me okay through?
Yes, we can, yeah.
So I personally haven't had to do a manual dexterity station myself, but I have heard that they've got students to kind of thread things through small holes and things like that, or make a shape with and bend a wire with kind of orthodontic wires to make like a loop or a certain shape. Correct me if I'm wrong, or if anyone else has any ideas. I know that during one of my panel interviews, when I got asked about manual dexterity, you can also kind of discuss what you've done to prove it. So that if that's like art or musical instruments, there are some really great examples to prove that you have like decent manual dexterity skills.
Fantastic. I think, does anyone else have anything to share regarding the manual dexterity section?
Origami. That's it.
Nice. I was also going to say one thing. Sometimes with the manual dexterity section, they look at like your precision. So they might give you like some certain measurements you need to follow, etc. You might be thinking, well, I don't have a ruler or anything. How can I do that? One thing I did, which was, it's a bit like weird, was before I had any of my interviews. I put a ruler up to my finger, and I sort of had like the estimations of the different distances, and I kind of used that as a measure. So you could kind of use that if you want. It's just a little tip that I found out.
Also, in a lot of the cases, it's not the finished product they're looking for, it's the way you got there. So if they're bending a wire in front of you to make a triangle, it's not that they want to see that you can make a triangle. They want to see that you're holding the pliers the same way they're holding. You're bending it in the same direction they are. It's about like watching the process and doing the process, not how far you get into the process, if that makes sense. So it's the accuracy you do it with, and how much you notice of them. And also, if it's online, you're unlikely to be bending wires and doing stuff like that. So it may be more of a talking station rather than a doing station. And just remember that playing an instrument or doing origami or things aren't the only ones that show manual dexterity. It's not a set answer that like, oh, if I say I stitch, that's a check on my list. Be honest, because they're gonna ask you questions like, oh, so what do you do there? Because they can probe you more because they're not testing it in real life. So they can say, oh, what thread do you use? Or what this do you use? So don't lie. That you can relate pretty much anything with manual dexterity, even baking or working on a car. If you like working on cars, playing video games, you can relate almost anything to manual dexterity as long as you reflect on it and explain why you think that relates. So yeah, just make sure you don't lie.
Absolutely. I think having complete transparency and honesty is something critically important as part of your interview, as these interviewers will be able to identify if you are, going far from the truth, and it's not a really good situation to land yourself into. Do you know of any sites where I can get good access to dentistry-related articles? Sana is asking.
Yes, our website. We actually have former dentists and dental students who've written plenty of articles. We have a lot of cosmetic dentists, max fax dentists, and actual practitioners, owners who literally explain what it's like to be working in a dental practice and stuff like that. So they're all available free of cost on our website, which you can have a read of. In terms of other resources that we wouldn't be able to necessarily comment on how good they are or if they're any use to you at all, but we can guarantee our resources, they do really help out in terms of the feedback we've been given. So do check those out. They're available on our website and free of cost.
Will they expect us to have read more articles from after our personal statement was handed in? TAs asking that. So I assume that that relates to that first question regarding further insight into dentistry. Adam, do you want to touch upon that?
Yeah. Just keep reading. Just keep reading on stuff about it. Again, it's nothing like crazy. No one's expecting you to know the whole degree before you've done it. It's just British Dental Journal does some free articles. Have a look at that a few days before. Just have a look at general news articles, because you never know what can turn up. But simply put, yeah, keep reading stuff. Just light reading. Just 10 minutes before you go to bed, something like that.
Excellent. Just going through some of the other questions now. So we have a question on what's life like at each individual university. So maybe everyone can give a small snippet of their experience at their respective university, what year they're in, and just a very brief summary.
I'm happy to go first. I'm a 5th year student at Newcastle, and I did graduate entry, although I'm doing the undergraduate degree. I think Newcastle's a pretty laid back city. There's always something going on. We're by the coast, so we've got a little bit of both, if you're interested in the actual location as well. Newcastle, I think if you're interested, I think they're still doing panel interview. And the teaching's pretty hands-on, so from 3rd year to 5th year, half of our day consists of clinical time, and then the first 2 years is quite heavily on academics, anatomy, with the odd bit of clinical time. Towards the end of 2nd year we do key clinical skills, where we learn all clinical skills on phantom heads before we start seeing patients at the start of 3rd year. So that's just how kind of Newcastle works, and if anyone has any other questions about Newcastle, I'm happy to answer those as well.
And I can talk for Plymouth. So I'm a 5th year, final year dental student at Plymouth. The way they currently do their interviews is MMI, but they used to be panel. So with the current circumstances, if they're doing it over Zoom or Teams, they may change back to panel. No one knows yet. But in terms of the city, it is quite a quiet city compared to other ones. It's smaller. It's in Devon, near Cornwall, and it's really, really nice if you like walks and beaches and the sea, because literally everywhere you turn there's sea. And also in Plymouth, you spend different years at different locations. So 1st year and 2nd year you're in Plymouth. 3rd year you live in Plymouth, but you travel to Exeter for clinics. 4th year you move to Truro, which is in the centre of Cornwall, and then 5th year you're back in Plymouth. So it gives you a bit of movement in your 5-year degree, which is quite nice. Also, we start seeing patients in 1st year. So you do Bob the first day you turn up to dental school, which is working on the phantom heads. And then by the end of 1st year, you're seeing patients on clinic, and then the days just increase by 1 every year. So it's quite hands-on straight away. And in terms of examinations and things like that, we are very practical based, and then we have 3 examinations that you sit every year. So it's quite different in the way we hold our exams and things, because a lot of it is just practical based on what you can do with patients and things like that. Yeah. And I just saw, is there any other takeaways in Plymouth? Yes, there are, and there are. It is growing. When I first came here, I knew people used to struggle, but no, I think we are growing. It's just a quieter place than most of the other dental schools.
I can do Leeds. I guess Raza can do a bit Leeds as well. But I'm currently a 3rd year dental student. In terms of clinical exposure, it was one of the main reasons why I went for Leeds. In the first place, it comes quite early on, so we do quite a bit of work on phantom heads in 1st year, more towards 2nd and 3rd semester. By 2nd year, you're seeing your first patient, so that was without a doubt probably one of the best experiences I've had so far, because right after that COVID hit and I've not had much experience since anyway. We also have our Simodonc 3D simulators, so that's something we use in first year as well, and it's just kind of building up those clinical skills. So you start with a bit of theory, you build up to your 3D simulators, you then go from there to your phantom heads, and then you're kind of doing it on real people right from there. So it's quite a good like gradual building of knowledge, but at the same time it's really thrilling because you're kind of thrown into it. It's a balance. Besides that, the city, Leeds is generally known to be quite a good city for students. Lots of culture, generally lots of things to do. So yeah, I love Leeds.
Am I the only one left? I think I am. So I'm. Oh, sorry.
No, go ahead.
Apologies. I'm a final year at Barts, which is in East London. So first year is pretty theory based with a bit of practicing on your partner sprinkled in there. Second year, you start to pick it up a bit. So you'll see your first patients like middle second year. But obviously, I don't know how COVID's going to be in the next few years, so who knows. But yeah, second year is where you really start to get into it. So that's when your phantom heads will start. That's where in my opinion, the real dentistry starts. Third year, fourth year is just all out seeing patients. You get a ton of patient exposure. And the good thing is each year is about 70 people, which is a pretty small number compared to most dental schools. And there is an abundance of people in East London who need help with their teeth. So you'll never have a shortage of patients. And we're also one of, I think, 3 dental schools in the UK in which students have full access to a dental laboratory as well. So in the process of making stuff like dentures, splints to protect your tooth from grinding, you can do that all yourself if you want to. And you can look at the process and play with saws and drills, and it's just really fun. And then final year is just sort of consolidating all the knowledge that you learned in the previous years and just finishing off your practical work. Overall, it's pretty darn good. London is London. It's a really, really nice place to live. And the course is run excellently. So I would recommend it to anyone who was thinking about it.
Sorry, yeah. Cool. And kind of coming from the other side of London, I'm a third year student at King's at the moment, King's College London. And in terms of what the experience has been like, it's been interesting. It's definitely, dentistry is definitely a course that's quite academically rigid. So you really need to keep on top of things. And it's quite hard to get that like nice work-life balance that everyone always seems to talk about. With regards to King's, I'd say one of the best things is the lecturers. So a lot of the time you have very knowledgeable lecturers. Like half the time I'm revising something, I'll look up at the authors and I'll be like, oh wait, that's the person that gave me a talk last week. So that's a nice thing to have. With regards to our clinical exposure, King's starts like actual, proper hands-on clinical exposure from second year, which isn't as early as Plymouth, I know, but it's still, relatively early on. And yeah, and obviously London is lovely, as Adam was just saying. At Queen Mary, the same sort of thing. It's a very enjoyable experience. You have a very diverse cohort, and kind of in the opposite of Queen Mary's, which has quite a small cohort. King's is like rather large. I think we have about 150 or 160 students, with some that join on as postgraduates later. So if you like having like a big community, it's kind of like a massive family at King's. A lot of academics, a lot of competition, I'd say, but overall it is very, very fun. So yeah, I'd say if you like London and if you like to work hard, then King's is the place for you.
Fantastic. So we've got quite a few questions. So what I'm going to try and do is ask away, and then we'll try to get through all of them so everyone feels that they've had their question answered. Next question is, what's the best way to improve manual dexterity? I'm not really good in making origamis, but I've done other things which shows that I have good manual dexterity. Whoever wants to answer that, they can go straight ahead.
Okay, cool. Yeah, I'll say a couple of things here because I'll be honest, I had the exact same issue. So I was really stressed out about the manual dexterity stations. I'm not very artistic. I don't really do anything with my hands that much. So it can be quite difficult. But I think something that Adam was mentioning quite a few times was origami. That's one way that you can kind of improve your manual dexterity skills. It takes a lot of precision and a lot of, like concentration. So that's one thing you can do. Another thing is just going online and looking for different things that you can practice. And a lot of the time, with the manual dexterity stations, I just want to make this very, very clear. You might not be able to do it very well. You might not be fantastic, but it's more like the reflection and how you go about doing the actual action that the interview is looking at. So don't stress too much if you feel like, oh, I'm going to be really rigid. I'm not going to be able to do this. Because a lot of the time, the actual like stations can either be really complex or they'll be quite simple. And it's just the luck of the draw on the day. But yeah, in terms of what you can do, just practice origami at home, look up some methods online, and yeah, I hope that helps. But as I said, I didn't really do too much, and I had a manual dexterity station, and I was fine, so I wouldn't be too worried when it comes to that.
Okay, fantastic stuff. If an interviewer asks if they have any questions for them, what are good questions to ask at the end?
So one question that when I was interviewing people as a student interviewer, one of the applicants asked, if you were to start dentistry all over again, what would you do differently? And I think that's quite a cool question to ask. And I'd never heard something like that before. And it kind of, the good thing about that question is it shows that you value the importance of reflection and of thinking, because one of the best qualities to have in a dentist is the ability to reflect, to look back on your previous experiences and think about how you can improve on yourself to make yourself a better person, a better professional. So that was a question that I thought was really, really good.
Amazing. That is a great question, actually. We've got another question here on what if you don't know how to answer the question at all? What would you say?
A lot of the questions are based on you, not anything else. So if you do really struggle, it's probably the stress that's making you struggle, not the actual content of the question. So take a minute. You can even say to your interviewer, just need a minute to gather my thoughts, take a deep breath, and start again, kind of thing, or ask for them to repeat the question. But most of the questions you do get asked aren't going to be horrendous questions that you've had to have a lot of prep or research for. It should be about you, your personality, and your journey into dental school rather than anything else. I remember in one of my interviews, they asked about, I'd written that I'd done some research in my personal statement, saying that, oh, I found it really interesting and I read up on it. And they asked, oh, so that's really interesting. Can you tell me some advancements on that? Have you kept up to date since your personal statement? Now, as we keep saying, do not lie, because they'll probably know more than you. So I didn't lie, and I said, I actually didn't. But you know what? That's a really good point. And when I go home, I really want to look up into that, because I remember reading on this, and I reflected, I looked back, and I was like, actually, that was really good research. At the time, it was really interesting, and I will go home. And if you show that you realise that you haven't done something and you're motivated to continue to do it, they're usually happy with that answer. So just be honest, reflect if you can on the question they ask, and then say like you're going to be proactive and you're going to look into it, and it'll be really interesting. And you can even ask them, do you know anything more about that? Because it'd be interesting to see your point of view on what's going on. And that way you can have a conversation about it too, and kind of make it less of an awkward silence.
Fantastic. We've got a question here. How long should we spend talking per question? From Sophia. Another webinar said it was 6 minutes, but at least I think that's, but I feel that's too much. So Sophia, I think there's the time spent per question would very much depend on the dental school that you are sitting your interview at. Every interview will have their own different format, which will be sort of specified before you begin that interview. So I think it's hard for us to say a blanket rule as to how many minutes per question. I think every sort of interview will have its own time limit or recommended time per question. So that will be dependent on the dental school. Minaz asks, when can we expect interview offers generally? Does anyone have any indication of offers for interviews?
Massively varies based on the institution, massively varies. And keep in mind that just because someone else has got an offer from the same uni and you haven't, that doesn't mean you got rejected. Sometimes it's just delayed. It's we shouldn't give a definitive date because it can be really, really early or really, really late. Just once your interview is done, don't worry about it too much. Just move on, focus on your final exams, focus on your next interviews. But it's so variable that giving an answer wouldn't be useful to you.
I think that's understandable, yeah. How much of a pause can we take before answering a question in an interview? I think, Aslam, you mentioned something about pauses.
Yeah, so about the pauses, now I'm not saying with every question, take 30 seconds out, right? It's just if it's emergency situation, you completely blanked out, you missed the question, then you can. I'd probably say like don't take too much time if you do have to do that. Ideally like 20 seconds, I'd say, but ideally you just want to keep on your toes, stay focused, listen to the question, don't let the other questions be in the back of your mind, and just answer it as soon as you can. But like, yeah, not I didn't mean like every question take a minute out, because that's suicide.
That's understood. In terms of, someone's asked a question regarding factors which may lead to rejection. I think there's various factors which may lead to a candidate being rejected, or not necessarily such a black and white situation, but there may be multiple things which that individual brings up or lacks bringing up. Most commonly, I'd say that possibly result in that individual not coming across as confidently or as well researched as other individuals. So rather than factors that actually lead to rejection, it's more about what things did they lack that sort of made the interviewer think that they should deserve a sort of a place at dental school. And obviously, don't forget that in the MMI interviews, if you are sitting an MMI interview, then you've got various stations whereby you will be able to show your confidence and your research and your knowledge, and therefore you have various chances to shine. And as a result of that, I don't think you should necessarily think about avoiding certain things, rather than you should be thinking about what things you can do to excel and make yourself stand out. So does anyone else have anything to say on that?
Yeah, it's okay just to elaborate on that. I think also just to be careful, not so much like to avoid rejection. I think a big focus would be on ethical questions. You don't want to be deemed as someone who's going into the program as unsafe or unethical. I think just be careful with those sorts of questions as well. That would be the only thing I was going to add.
Agreed. Would you get cut off mid-sentence in an MMI interview if your time is up? Anyone who doesn't like Faris, you've sat in an MMI interview, so what's your...
Yeah, so with MMIs, you have to bear in mind there's a reason why there's a time limit, because you have to stay within that time. So yeah, if the time's up and you're halfway through a sentence, they will cut you off. Sometimes if they're a really, really nice interview, they'll let you just about finish that sentence and that's it. But that will be the absolute maximum they'll do. It's part of the skill that they're assessing, is like your time management, your organization. And yeah, that's about it really. I'd just say, just bear in mind the time. I think you could probably have a watch with you, so you can use a watch, or some universities actually give you like a little sound when you're 1 minute away from the end, so that can be quite helpful as well. But yeah, they will cut you off if you do not finish in the permitted time.
Fantastic. How are MMI interviews actually marked, i.e. are each station marked out of score and people with higher scores get a place? How does it work? T has asked.
Yeah, you're spot on. what they'll have at each station, there'll be a marker. That marker will have a criteria or a mark scheme. They will tick what you did, they won't tick what you didn't, and everything will be added up at the end. And then I think it'll probably be based on percentiles or a certain cut-off score. If you get it, you get it, and if you don't meet the score, you probably won't get it. Simple as that.
If you some interviewers ask really unique questions, i.e., what type of biscuit would you be? How should you answer such questions, and what skills are they assessing? Has anyone heard of?
Yeah. Okay. So at my interview for BARTS, I was asked, "What is your spirit animal?" And I was like, "What?" Well, I didn't say that, but that's what I was thinking. And then, weirdly enough, I went for a unicorn. I don't know why. I just said it. It just came out of my mouth. So basically, what they want to know is they want to see how you think. So stuff like, if you were a biscuit, what would you be? They want to see if you, number one, if you're on your toes, because that's going to surprise you. And number two, that you can justify your answer with reasonable and critical thinking. That's what they're assessing. So let's say they ask you something like, "Oh, what biscuit would you be?" And you said, "Oh, I would be a digestive." And they would ask you why. And you would say, "Oh, because they're liked by everyone. They're great over a cup of tea. They complement things very well." Stuff like that. Like, you need to have a reason in your head. So that's what they're assessing. They're assessing your critical thinking and try and come up with a unique answer.
And just
I actually had that question. It was, sorry, you can go on.
no, go for it.
I actually had that question. It wasn't dentistry related, but it was something for, I had like a maths interview, and the interviewer, he laid down a sheet of paper, and he was just like, "First question, if you're a biscuit, what biscuit would you be?" So I actually said Oreo. And then he basically wanted to see, A, whether you'd get thrown off by that question, because most people don't expect it. So you would just be like, "I don't know," or what kind of. So they were kind of assessing, like, can you think of something on the spot? And secondly, like Adam said, can you give a reason for it? So whatever your reason is, as long as it's valid and it makes sense, then that's fair. So with Oreos, I remember I said, because they're very nice, they're very popular, they're available, and they're a bit classy. So that's what I said. And then so it's just a weird question, but they just want to mainly like throw you off guard, and then just see, because everybody's expecting the normal questions like, "Oh, explain this theory," or "work out this in front of me," or stuff like that. But they don't expect that type of question.
Yeah, exactly. I was just going to say, they just want to see what you're like thinking on the spot. And also they want to see how you structure your answers, not that you just start babbling and be like, oh, I don't know what to say. It's a good one to show that they're not looking for a prepared answer. So they want to see what you're like. It's definitely, you cannot prepare for those questions. They want to see how you act like that. And also, it's a really good way of showing your personality. So you could be a bit cheeky if you wanted to, make the examiner laugh, get them on your side almost. Don't cross boundaries, still stay professional, but you can throw in the odd light-hearted, acceptable professional joke in order to get them on your side, because then you build that rapport with them, especially in panel. As soon as you break that ice, you can tell that their whole mannerisms kind of change, and they warm up to you, and you can be a bit more open to them. So use it as a way to lighten the mood, but also still answer the question and stay professional.
Very well said there. In terms of the actual interview, can you make notes in the 1 minute prep time before the station begins? Anisha's asking.
With regards to, with regards to making notes, I don't think in any of my interviews I had that opportunity. Most of the time, you all have like a 1 minute reading time that you can like read the scenario in, but I don't think you can take notes. Or for example, like for all of the universities I applied for, I didn't have the opportunity. And especially if you're doing it online, I definitely wouldn't make notes, because it might seem like you're reading off a piece of paper or you're cheating. So I'd just be really careful with that.
And in the past, I've been in one interview where they have let you make notes, but it's because you've had a scenario beforehand, an ethical scenario. You had to choose one of three. and then you're allowed to write notes and just for your own thought process, but you weren't then allowed to bring those notes into the interview. It was purely there for you to gather your thoughts, but then left outside the room when you go in. So yeah, and definitely probably with online, unless they've said to you you're allowed to make notes, don't try to make notes, because you will come across cheating, and that's unprofessional and a reason as to why they would reject you.
Just to add to that, if they show you a video beforehand and they say you can make notes, be very, very careful, because sometimes as you're making notes, you miss something key in the video. So my advice would be, if they do say it, it probably won't be long enough that you would need to make notes on it. So try not to, and try to just keep your focus on what is going on. That's just my 2 cents on it.
Wicked.
Yeah, my tip would be to listen to the interview as well, because they give out instructions really quickly at the start and you're just expected to follow them through. Don't do anything that they haven't said. So with our interview, she said you can make notes, but I just preferred not to, because it's just a bit unprofessional if they're saying something and you're just scribbling away. Plus, it's important to maintain eye contact when you're at the different stations. And I think, yeah, some interviewers, they prefer, they often keep like a stern face. It's not because they don't like you or anything like that. It's just because that's the way they've been instructed to do so. So everyone's treated the same way. And it's kind of to see how you would react to somebody being like really blunt with you and just putting you on the spot. I remember one of my interviewers, it was like a graph question that we had to discuss. And then she said, yeah, so what next? And it was just like, okay, but it's just how well you handle it. And she basically just said, all right, go on then, speak. Literally that at the start. And it's not that they're being rude or anything. It's just to see when you actually crumble in pressure. And yeah, it kind of separates the candidates who do and then who don't. So that's another tip.
We've got another question here on sort of confidence, and I think one of our panelists tonight, Faris, has got a YouTube video on that, so he'll be putting it in the chat for you to look at, which is really useful. We've also got a question on COVID-related questions that you could potentially get at the interview, and I think that it's a very difficult question to answer. I think COVID-19 brings about quite a number of different challenges regarding infection control, regarding patient management, regarding the amount of patients that can be seen in a dental environment. So I would suggest that the individuals read around the subject and the implications that it has on dentistry to sort of be more well prepared for questions like that. We've got a question here on gap year. So is it better to do a gap year before going to university to get in as much information as possible to prepare for your interview, or should you go straight into university by Yalda? Raza, you took a sort of gap year, so maybe you can shine some light for Yalda.
I think me and Jas both took a gap year, and I think it's okay. There's many reasons why people take a gap year. I didn't get any offers the first time round, although I had the grades. So I was just sitting there throughout the year with a bunch of grades and no offers for dentistry. It's just mainly how productive you can be in that gap year. For me, at the first few weeks were just laying back and just doing everything I wanted to. And then I did take up the year to pick up a job, found this company. What else did I do? I did more work experience, made sure my personal statement and my interviews were all sorted out, traveled a bit. And it's just the way you handle the gap year. It's not necessarily a bad thing. It may seem like, oh, all your friends have moved on, but in the long run, I think that gap year was like the best thing to happen to me. I'm sure Jas has her own opinions and journey.
Yeah, so mine was the opposite to Raza. I had my offers, but I didn't get the grades. So I had to take a gap year just to sit. Back in the day, we had modular exams, so I had to sit one module. So it was quite nice for me. I had a lot of time on my hands. I didn't have to do much revision. But as Raza said, it was probably one of the blessings in disguise. At the time, I felt like, well, at the beginning of it, I felt like it was the worst thing that could happen to me. Wasn't getting out of bed, just really taking it hard. But actually, it was a really good chance for me to prepare for uni, because uni is such a big step, and so much comes with it, independence and all of that. So it did give me that extra bit of time to figure myself out almost. And also, I really think it did up my application game. I had so much more to speak about in the interviews, especially. And there's so many things out there for gap year students. Like, I ended up going to America and did work experience out there at a dental school, which like it's hardly ever heard of. So in my interviews, that was something I could really speak about. I also worked at a dental practice for a bit. So things like that, like it's, you can't beat that experience. And it really does make it a lot more easy to talk about it in your interviews. That being said, COVID at the moment probably stops a lot of that. But as long as you stay proactive in your gap year and help, even if it's just within the community, it doesn't have to be dentistry related, it's still going to put you at a better position than other people who didn't get that opportunity. Oh, also, sorry, just remembered. If you get your, if you take your gap year because you didn't get offers or didn't get the grades, make sure you ask for feedback, because that you are entitled to get that feedback back, whether that's from your personal statement or from your interviews. They can tell you what you did well, what you did wrong, and just ask for it, because it will always help for the next years. So make sure you ask.
We've got a lot of questions related to individuals receiving replies from different universities. Unfortunately, we don't hold too much knowledge with regards to receipt of offers or receipt of interviews. However, all I can say is make sure you keep up to date with your emails, and if you have any doubts, then the best people to contact are the administrative team at the universities. So definitely give them an email or a phone call if you have any questions, because they will be the best people to give you the most up-to-date information with regards to those questions. So the next few questions that we've got are related to, there's one question is, any information on studying abroad by Mohammed? We have got a whole article written by someone who studied abroad on our website. I will add that in the chat box so you can see that's a free article on studying abroad. In addition to that, we have got a question by Al Fatiha on what MMI stations can we expect. So does one of our team members want to vaguely and generally just talk about the types of stations without going into too much detail, and obviously not breaching any current interviews?
Yeah, I don't mind going through, like, so some of the stations that you'll expect to find are things like role plays, ethical scenarios, questions about your skills, so skills-based questions, questions about you, so like just personal questions about your experiences or what makes you suited to dentistry. Obviously, the infamous why dentistry question. You should always be prepared for that. Try not to be too monotonous or boring with it as well. What else? You have data analysis questions. You can have lateral thinking questions. You can have logical puzzles. What else? You can have manual dexterity stations. You can have weird and wacky questions like, what biscuit would you be, or where would you, like the ones you mentioned before. And the basic thing I'm trying to say here is there are so many questions you can be asked. So many. And you shouldn't think, oh, these are the set questions that are asked at each university. You should be thinking, well, I can be asked everything. What are the main topics? So we've mentioned a lot of them today, and what you should cover. And alongside that, you should be looking at what are the transferable skills I can mention in each of these types of questions. So, and at the end of the day, one extra thing as well, sorry, make sure that anything that you do, all the prep that you do, you always remember that it's not just about your personality, it's not just about you. You need to also be able to present why you would be a good dental student, why you're going to be a good dentist in the future. So that's the whole point at the end of the day. They're not, they want to make sure they actually going to be good for the course. So yeah.
Wicked. Okay, so I think the final few questions we've got are in terms of, here's a good question. Is there a cap for graduate entry numbers per institution? I think Jenna hopefully be able to touch upon that.
Yeah, so I always ask that question whenever I went to interview at the interviews I interviewed at, and they tend to say it's about 5%. So at Newcastle, the intake's around 70. Apologies, that's the dog barking. interviews at about 70, and so they took around three students, and then I remember asking at graduate entry interview for King's, and there was only 20 spaces, and they took one or two graduate entry. Oh, I apologise, that's international. So I really messed up that question, I apologise. That's international percentages. Graduate entry, there's about 6 at Newcastle, but I'm not sure there's a necessary limit, but there doesn't tend to be as many. There's always like a lot less than the undergraduate.
I think in regards to the graduate entries, we have got some information on our website. We've created a spreadsheet which is available on our website for free, and that website details different sort of entry requirements, UCAT cutoff scores, BMAT requirements, work experience requirements, and it also has contact details for each university. So I would suggest that those graduates wishing to study and sit in at an interview at a dental school do contact the individual respective dental schools to find out more information regarding numbers, because the dental school application is always subject to change. So I'd certainly recommend contacting the admin team.
The only thing to add is in interview, they will tend to ask you about what you studied and how it might benefit like the dental school, and how your extra experience at university might make you a better candidate. That's just something I noticed over the few interviews that I did.
Absolutely. I think having a good understanding of your previous degree and relating that to your application and the reasons for application is really critical as well. We've got a question. We've had lots of questions. Is panel easier than MMI? Is MMI easier than panel? I think does someone want to sort of just answer that type of question? I don't think there's a correct answer there, but just one of our team members want to just shine some light on that.
I'd agree with what you said. It's quite subjective. Everybody has different kind of things that they prefer. Personally, I preferred MMI. I like the fact that you could kind of, if you've messed up one station, you've got a fresh start each time. You've got about 7 stations to work with, so it's 7 fresh starts. Other people prefer, just sitting down, having a chat, talking. I was going to say one-on-one, but it's usually like 1 to 3, and just talking to people. So it's either way, you're being assessed on similar kind of skills. You're being assessed to see whether you suit a career in dentistry. So be prepared for both, and good luck, I guess. It just depends. You'll find your preference as you go through it. You won't know before you go into it. And after you've been through it, you'll have your preference, but you'll have done both, and hopefully you'll have done well at both. So, yeah.
Yeah, I totally agree, Fadila. I think it's difficult to say which of these. Everyone has different preferences. Really good question from Roman. How long did you spend preparing for your interviews? So everyone on our team can give their honest answer with that.
I'm going to be really honest. I didn't spend many hours revising for my interviews, just purely because I wanted to be as genuine and authentic as possible, and I knew how much they dislike people who have prepared a question. So although I did research into what kind of questions they would ask and what my main points would be, I didn't actually rehearse a straight up answer. And also I would just go to teachers, because back then we didn't have a platform like this, and say, do you mind just asking me a few questions about, can you read my personal statement actually? Just ask me a few questions that you think are interesting from that. And that's how I revised. I never actually sat down and wrote out an answer or anything like that. And I am glad I never did that, because it just meant that on the day I was really genuine in myself, and I think they got that on the day. So yeah, that was my experience.
I got my interview invitation in about January, and my actual interview was in February for Leeds. I spent that period from day I got the invitation to the interview. I spent that period literally revising, and that's where I actually met Cal as well. I went up to his practice, and I took that period just to get used to understanding the MMIs, what they were, looking up everything I could possibly online and preparing, but not too much. It wasn't like every single day. It was more like one day prepare for about a couple of hours and then relax and then go back to preparing like after 2 days. And also it was mainly a combination of staying relaxed because you don't want to get to the interview and just have a bunch of things memorized and then you expect something to say and the questions just don't match what you've revised. You want to have a balance of, for example, out of my work experience, I remember seeing a rubber dam procedure go ahead, and I knew that was something quite unique that I could mention, but I didn't memorize what to say. I just knew that I could say that if it came up, and I knew the points to say. Similarly to about my personal activities, like I knew I enjoyed my sports and reading and stuff like that. So have an understanding of what to say in your personal statement, which you've already written to the university, but don't go ahead and rehearse it. That's the key, because once you rehearse it, then no matter what the question is, you'll only have one answer to give, so you can't adapt. And that's the key, I think. Yeah, that was my story.
Just adding to what Raza said, you want to keep it as natural, like give it as much of a natural feel as possible. You don't want to seem robotic or rehearsed or just monotone. So what I did personally, a few days before each interview, I kind of had subheadings. So for example, ethics, or suddenly very blank, but you know, just different headings that I knew would possibly come up. And so I had like bullet points under each heading, things that would be important, things that would probably crop up. And so I didn't have like a rehearsed answer that I could just refer to, and I could then use those kind of bullet points to match the question I was asked, so it kind of be adaptable in that way. Don't know if I fully made sense there, but I think you understand the point, hopefully.
Yeah. And with regards to me and prep, I'll keep this short and sweet. I didn't do too much, I don't think. I think upon reflection, maybe I should have done a bit more, but thankfully it didn't affect me too much. One of the things that I recommend is just trying to like attend these types of webinars. Back then, what I went to were like universities in London would do these like free practice courses, like different societies, and I'd go to those. And that's kind of the scope of what I did for my interviews. Like I kind of just went to those, practiced. As others have kind of said today, sometimes over prepping can be like a big downfall for some people, and it's nice to be natural. But a very important thing to know as well is just be honest with yourself. Tell yourself, okay, well, am I a confident individual? Do I communicate very effectively? Is it one of my strengths? If yes, I'd say just try and have like a rough outline of what you want to say, and I'm sure you'll be fine in the interviews. With other people, you might need to prep a bit more, and that's okay. We all have our strengths and weaknesses, and if that's the case, again, get involved with all these webinars, like look for mentoring schemes, etc., etc. So it's varied, but overall, I'd say for each of my preps, I probably did like a couple days before I actually had the interview. That's the prep that I did for the specific unis. That's kind of the method I took.
For me, it was 2 weeks. That was the length of time. I would do maybe an hour every day, something like that. Just looking into something. My main piece of advice would be, obviously don't rehearse your answers, but think of your interview like a conversation. In a conversation, you don't rehearse what you're gonna say to someone, but you know what to say, don't you? So in that same way, you need to know what you're talking about, whilst not saying it as if you're, doing a theatre performance and you're just saying these lines, if that makes sense. Think of it as a conversation, if anything. And that means you do need to practice talking. Don't practice a specific answer, but practice talking. That's really, really important. If you don't know who to go to, family, friends, one of us, something like that, but practice talking.
If I can, I just want to add very, very quickly onto Adam's thing. I just really agree with this point about conversation. So one of the things that people really struggle with is that they think that an interview is like an exam, so that the interview's just got like a checklist and say, yep, you said this, this, this. A lot of the time, they're looking at your communication skills. That's a really key element. So ensure that, again, think of it as a conversation. Like, obviously there's some things that you do have to remember, like papers, etc. But overall, the most important thing is just be really chill, have a good level of professionalism, and understand that it's not there for you to just spit facts out and try and sound smart, because if you think you sound smart, the interviewer probably thinks, oh, this person's rehearsed it, this isn't a great answer. A lot of the time, the best people that do interviews, or the best people that I've seen when I do practice with, are the ones that are a bit more relaxed and they know what they're saying. Yeah, as I said, like, the conversation, as Adam said, is really, really important. It's a really good analogy just to remember, like, when you talk to your friends, you don't plan out before what you're going to say. You kind of know, like, within the flow what is going to be mentioned. So yeah, that's what I wanted to add on.
I think that's why the mentoring scheme is so important that we offer, because it gives you that chance of talking to someone that you don't know and having that conversation and thinking on the spot. So yeah, highly recommend that, because it's speaking to someone you don't know, which is really hard until you've done it.
Got a question here. Thank you, everyone. We've got a question here about can they ask questions about your A levels in an interview?
Yes, they can. So I took drama as an A level, which is quite unique among dental applicants. Most people will go for 3 sciences and maths, that kind of thing. So they did ask me, why did you take drama? And my answer, believe it or not, I wasn't prepared for that question. And what I answered was, like, they said, how will what you learned in drama relate to dentistry? So then I talked about public confidence, how it improved my communication skills, how it improved my team working skills, working with a cast, all that kind of stuff. So yes, they can ask you about your A levels, what you learned from your A levels, and how what you learn can be transferable when you qualify as a dentist. I hope that answers your question.
Wicked. We have quite a few questions around hot topics in dentistry and like advancements in dentistry and things like that. So I think a couple of things that individuals can do. So firstly, you can look at websites such as dentistry.co.uk, which is effectively like a portal for news and information regarding recent sort of advancements and news in the dental field. And that's a website, dentistry.co.uk. In addition to that, our free work experience course, which is available on our website, also contains a module on sort of advancements and technologies in dentistry, and that's free to access. And I've just put the link in the chat box there, so you can access that for free as well. We also have some questions regarding the UCAT and cutoff scores, and I think I've touched upon that very briefly. We do have a free spreadsheet which we've created based on the current information that is available online, which gives information and the cutoff scores for each individual university that requires a UCAT. In addition to that, we've got a lot of people commenting what biscuit they may be, which is quite funny. How long would we usually have for preparation after receiving an interview offer? Muana asked that. Has anyone got some information?
I had a month. I had about, I think the minimum they usually give you, I think, is 2 weeks. But that's what I got from speaking to the admission team at Leeds. They usually give about 2 weeks minimum. But I had about 4 weeks to prepare.
Excellent. I think everyone will get a different amount of time, so I don't think we can be rigid on that, and we wouldn't want to give you a specific answer. I think that the best thing is to do is to, once you have that in receipt of your knowledge, is to start preparing from that day. I don't think you should rest on your laurels, especially as dentistry is very competitive to get into. We have got a question, and actually this is a reoccurring question that we get in lots of webinars. Sorry, why dentistry and not medicine? And this is an extremely popular question that I think can be asked at an interview. And we have actually dedicated a full module to this on our dentistry experience course. So please check that out. I've just put a link in the message in the group chat. So that's completely free to access. And one of our co-directors, Haroon, has created a fantastic module on that, explaining the differences between both professions, which are both well respected, and why one may choose dentistry over medicine. So please do feel free to access that. We're more than happy to help you with answering that question on our course. Okay, how does the university decide who's going to get in, who's going to get an offer after an interview? Do they score all candidates and rank them? Aman's asking that.
Right. So because I've been on an interview panel before, the way they do it at Barts at least is there are 70 to 80 places, okay? And each interviewee will get a score based on several domains. So this is simple stuff like how do you communicate? What's your body language like? Quality of your answers, all that kind of stuff. They tally together the answers, top 70 gets in. Simple as that.
Thank you, Adam. I think that every university will have their own scoring criteria, which the interviews are calibrated on, firstly. Depending on the quality of answers of that particular cohort, I assume that will give the sort of that way of balance as to whether individuals do get in or not. So it will very much depend on the individuals around you who are also interviewing at the same time in that cohort. I think the key thing to take away from it is, rather than focusing on what things I should avoid or specific cutoffs, is just to try your best and be yourself, as everyone has spoke about today. It's really about trying to prepare as best as you can, focusing on coming across really honest and open, and not lying, as many of our speakers have touched upon tonight, and also being trying to control your nerves, as Adam's talked about as well. Okay, Farah has asked, what if your previous degree isn't related to dentistry? She studied chemical engineering. Jenna, do you want
It's still,
yeah, whoever.
I was going to say, it still doesn't really matter. Based on like statements which I've read from graduate applications, which are in our book as well, as long as you're clear that you want to do dentistry and you have a valid reason for doing it, the most important part is, if anybody asks you about your previous degree, don't just go and belittle it like it was the worst thing in the world, because every degree is valuable and you've worked for it, so you should be proud of no matter what it is you've done in the past. It's important to acknowledge like some key skills that you may have found, like whether it was an essay-based degree, or you had to do a lot of research. So that's something that most degrees have. In terms of like chemical engineering in general, if there's any maths aspects that you had to learn, that can help you in a degree which is dentistry related. You've adapted to university lifestyle, so you're kind of used to the format and everything. Those are just some of the few things. I'm pretty sure Jenna has bit better explanation.
Yeah, I mean, I did a science-based undergraduate degree, but the questions that I was asked in interviews weren't necessarily more scientific. It was more to do with how I learned and what the skills adapted, for example, like organisation or just like confidence in presentations. It was more to do with how I've grown up as a person, rather than like more science, like in-depth science knowledge. So I really don't think it matters what sort of undergraduate degree. I do have friends that have applied for medicine and dentistry from very, very different career paths, and so long as you still have like the passion for it, then I think you'll be all right, and that will obviously show from your enthusiasm in an interview.
Excellent, thank you so much, Jenna. I've just popped a poll on the screen whilst we're answering the questions. If you could kindly answer that would just give us some great information and help develop our course further and our resources. If you guys are on Instagram as well, we have got an Instagram channel. It's I Want to Be a Dentist, and obviously we're constantly posting information and free advice, so please do follow us and just keep up to date with us that way. And this webinar will be placed on YouTube. In addition to that, obviously tonight we've launched our online dentistry interview course as well. So the link is in the chat. I'm going to put that in now. And obviously that is a course dedicated to individuals just like yourself who are in that position, sitting the interview. The course is developed by dentistry students, and it's really, really tailor-made for you, containing all the information regarding the types of things that you may need to know for the interview. I've got a question here regarding the BMAT. If I've not done BMAT, sorry, that question's a bit confusing. I think it's in a stream of questions. I'll ignore that one. Why are some people selected for interview faster than others for the same university and course? Adam, do you want to touch on that?
Sorry, can you just repeat the question?
Why are some people selected for universities interviews faster than others?
Okay. Literally don't worry about that at all. It's just sometimes the uni admin departments, they act out a little bit. The timing of when you get your interview offers or anything like that has absolutely nothing to do with how good your personal statement is or how much they value you as a candidate. Absolutely everyone, as soon as you get into that interview, everyone is on a level playing field. Do not worry about that. The reason why, it's just admin stuff. I wouldn't worry too much about it.
Wicked. We have got a question on the ranking. If you're deferring your application, how does the interview ranking work if you're deferring your application to study dentistry?
So universities generally, and keep in mind that every single university is slightly different with the way they work and the way they rank you and the way they mark you, but universities generally have a certain number set out for a certain type of student. So they will have a certain number of entries for graduates. They will have a certain number of entries for people that defer their entries for international students, etc., etc., etc. So don't worry too much about that. Just don't focus on the admin part of it. Focus on getting your interview right.
I think that's sensible advice. I think that we are now coming towards the end of the questions. Sarah's asked a question. What's first year like? Any tips for moving out?
I'll take this then. First year, it's quite different currently. It's nothing like how I expected it to be, but of course, there's nothing more that can be done because of COVID. But it's really enjoyable. I love every second of university, especially like when you get work done. It's like the best thing ever, submitting assignments and stuff like that. It does take time to get used to like the university styles of writing and stuff like that. But it's always interesting to see like actual patient cases, and we actually did a simulated patient day at Leeds, and next semester we'll be finally working on the simodonts and getting hold of the drill pieces. So yeah, there's a lot to look forward to. And in terms of moving out, it's what you make of it. I'm pretty sure like everybody has their own opinions, but yeah, it's good to move out. You have like that level of freedom which you may not have had before, and you're completely independent, so that's always good. But yeah, I'm pretty sure like pretty much most of us have moved out, so they can all share their opinions on that.
I think that leads us to a nice end for our questions. We've had one question come in. I've recently had a mock interview, and one of the questions was about managing a medical team. The interviewer asked how you would respond if everyone was exhausted. I gave an answer, but struggle with kinds of things. Say, how would you encourage someone? Like, how would you encourage someone? Has anyone got any tips for Harry there? Just touching upon his question.
Yeah, so that's a really good question. I've never seen something like that before. I would probably structure the answer firstly into finding out why they're exhausted. What is happening? Is it a structural problem, an organizational problem? What's going on that is making people tired? You would then try to address the issue. Now, it's hard to tell how you would do that because you're not exactly sure what the issue actually is. But this is stuff like effectively communicating with your team, trying to find solutions, stuff like that. And then the third part of your structure would be, in the future, how can we prevent something like this happening again? Because if you are exhausted, there is a chance that patient care can be of a lower standard. So that's kind of how I would structure it. But it's hard to answer that question without knowing why they're feeling that way, if you get my drift. I don't know if anyone else has anything else to say about that.
Yeah, I'll just add as well, like, here's a good opportunity for you to talk about your empathy skills and like your teamwork skills. As Adam said, I think it's good to break down the question, because first, when you first see this, you're sort of like, I don't know what to say, but breaking it down to different steps is good. One thing that I just say in general, just try and integrate some skills. So talk about how you'd communicate with them. So non-verbal communication, the tone of your voice, being empathetic and being empathetic. Now, one thing that I realize with a lot of students is they find it really hard to explain how to be empathetic. But a lot of the ways that you can see show empathy is through active listening. That's one way that you can do it, which basically means you're really making sure that the person in front of you understands that you're listening to them, and you do that. Should I explain? I'm not going to explain it because it's a bit confusing, but you can Google it and have a look into it as a way of showing empathy. But yeah, that's all I'd add on it. It's just maybe mention a few of the skills that you think would be important here for you to deal with this scenario, and make a relation to dentistry at the end if you can, time permitting.